Hello and welcome to our channel. If you're here, you or a loved one might be facing the daunting prospect of cataract surgery. Cataracts can cloud your vision, making everyday activities challenging and diminishing your quality of life. But don't worry. Today we're going to break down everything you need to know about cataract surgery, ensuring you feel confident and prepared for the journey ahead. Make sure to stick around till the end because we'll be sharing some crucial post-surgery tips that you won't want to miss. Let's dive in. Understanding cataracts. First, let's understand what cataracts are. Cataracts occur when the clear lens of your eye becomes cloudy, affecting your vision. This condition is usually age-related, but it can also result from injury, certain diseases, or prolonged use of certain medications. Early symptoms might include blurred vision, difficulty seeing at night, or seeing halos around lights. Left untreated, cataracts can lead to significant vision loss. Why surgery? So why is surgery necessary? While glasses or stronger lighting can help manage early symptoms, surgery is the most effective treatment for cataracts. It involves removing the cloudy lens and replacing it with an artificial one. This procedure can restore clear vision and drastically improve your quality of life. Pre-surgery preparation. Let's open our first loop by discussing how to prepare for cataract surgery. Preparation is key to a smooth surgery and recovery process. Here are the steps you need to follow. Consultation and tests. Your ophthalmologist will conduct a thorough eye exam, including measurements of your eye to determine the right lens implant for you. You might also need to stop certain medications a few days before the surgery. Medication management. If you take blood thinners or other medications, your doctor will advise you on how to manage them pre-surgery to reduce any risk of complications. Arranging transportation. Since you won't be able to drive immediately after the surgery, arrange for someone to take you to and from the hospital. The surgery day. Now let's talk about what happens on the day of the surgery. Cataract surgery is typically an outpatient procedure, meaning you can go home the same day. Here's what to expect. Arrival. Arrive at the hospital or surgical center as instructed. You'll be asked to fill out some paperwork and change into a surgical gown. Anesthesia. Your eye will be numbed with local anesthesia, and you may also be given a sedative to help you relax. This ensures you remain awake yet comfortable during the entire procedure. Procedure. The surgery itself takes about 15 to 30 minutes. Your surgeon will make a tiny incision in your eye to remove the cloudy lens and replace it with an artificial one. Modern techniques like phacoemulsification use ultrasound waves to break up the cataract, making the procedure less invasive. Recovery room. After the surgery, you'll spend a short time in a recovery room. Your eye will be covered with a protective shield to prevent injury as it heals. Post-surgery care. Now, let's close the first loop by discussing post-surgery care, which is crucial for a successful recovery. Here's what you need to do. Follow-up appointments. Your doctor will schedule follow-up visits to monitor your healing. It's vital to attend these appointments to catch any issues early. Medications. You'll be prescribed eye drops to prevent infection and reduce inflammation. Make sure to use them as directed. Activity restrictions. Avoid strenuous activities, bending over, or lifting heavy objects for at least a week. Also, avoid rubbing your eye. Protective measures. Wear the eye shield provided when sleeping and sunglasses when outside to protect your eye from dust and bright light. Potential complications and how to avoid them. While cataract surgery is generally safe, it's essential to be aware of potential complications and how to avoid them. Here are some things to watch out for. Infection. Follow all post-surgery care instructions and maintain good hygiene to prevent infections. If you notice increased redness, pain, or discharge, contact your doctor immediately. Swelling. Mild swelling is normal, but excessive swelling could indicate a problem. Use the prescribed anti-inflammatory drops to manage this. Retinal detachment. Although rare, be aware of symptoms like flashes of light, floaters, or a shadow in your vision. Seek immediate medical attention if these occur. Choosing the right lens. Let's open another loop by discussing the importance of choosing the right lens for your lifestyle. There are different types of intraocular lenses, IOLs, available, each offering unique benefits. Monofocal lenses. These are the most common and provide clear vision at one distance, usually far. You'll still need glasses for reading or close work. Multifocal lenses. These lenses can correct vision at multiple distances, reducing the need for glasses. However, they may cause more glare or halos at night. Toric lenses. If you have astigmatism, toric lenses can correct it, providing sharper vision without the need for additional corrective lenses. Discuss your lifestyle and vision needs with your ophthalmologist to choose the best option for you. Diet and eye health. Closing the loop on lens choices, let's touch on how diet impacts eye health, especially after surgery. A nutrient-rich diet can support your recovery and overall eye health. Focus on antioxidants. Foods rich in vitamins C and E, like citrus fruits, nuts, and seeds, help protect your eyes from damage. Omega-3 fatty acids. Found in fish like salmon and flax seeds, omega-3s reduce inflammation and support eye health. Leafy greens, spinach, kale, and other greens are high in lutein and zeaxanthin, which are essential for eye health. Real-life success stories. Opening another loop, let's hear from individuals who have undergone cataract surgery and successfully regained their vision. Their experiences can provide valuable insights and reassure you about the procedure. John's story. John, a retired teacher, was struggling with his vision, making reading and driving difficult. After his cataract surgery, John felt like he had a new lease on life. He was able to read his favorite books and drive without any issues. His advice? Don't wait too long to get the surgery. The improvement in quality of life is incredible. Maria's experience. Maria, an avid gardener, found her passion fading as her vision worsened. Post-surgery, she's back to tending her garden with ease. She emphasizes the importance of following post-op care instructions to ensure a smooth recovery. Innovations in cataract surgery. Let's close the loop on success stories by discussing recent innovations in cataract surgery. Advancements in technology have made the procedure safer and more effective. Femtosecond laser surgery. This technique uses a laser to make precise incisions, resulting in quicker recovery times and fewer complications. Premium IOLs. Newer intraocular lenses can correct multiple vision problems simultaneously, offering a significant improvement in vision quality. Minimally invasive techniques. Modern surgical methods are less invasive, reducing recovery time and discomfort. Final tips for a successful surgery. To wrap things up, here are some final tips to ensure your cataract surgery is a success. Stay informed. Knowledge is power. The more you know about the procedure, the more confident you'll feel. Follow doctor's orders. Adhere strictly to your doctor's pre- and post-surgery instructions to minimize risks and promote healing. Healthy lifestyle. Maintain a healthy diet, stay hydrated, and avoid smoking to support your eye health. Regular checkups. Keep up with your follow-up appointments to monitor your progress and address any concerns promptly. Thank you for sticking with us through this comprehensive guide to cataract surgery. We hope you feel more prepared and reassured about the process. Remember, cataract surgery can significantly improve your quality of life, restoring clear vision and independence. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to our channel for more health-related content. Stay tuned for our next video, where we'll delve into more tips for maintaining healthy eyes. Until then, take care and see you soon.